In villages all around, people gather to listen to these presenters on Heart Radio Uganda. But they're not here to give a rundown of the latest charts. The #1 issue is family planning, and this radio show gives them the chance to listen and call in. Today they will hear about contraceptive injections, using female condoms, and how to avoid teenage pregnancy.
It's very useful because our people in this community, we own phones, then people call and give views, and then the expert in the studio give back the views, all answer those questions.
When I was 19, I got pregnant. I decided not to abort, gave birth to my son, and after I thought it wise to go back to school. So I went back to school, and I had used family planning method not to mess up again.
This is one of the UN Population Fund initiatives to provide information about birth control to the people of Uganda. With a population of 34 million and an average of just over 6 children per woman, Uganda ranks among the fastest growing populations in the world. There are many reasons for the high birth rate, but this is mainly due to religious beliefs, polygamy and early marriages. In Uganda, large families are seen as a source of prestige and wealth, as well as some believing that child labour is a useful source of income. Prosy is 37 and has 7 children. She actually had one more, but he died just after birth. She now has a contraceptive implant which should protect her from unwanted pregnancies for the next 3 years. She tells us she wishes she had known about this earlier. Today she is walking for 1 hour to a nearby village. There are many villagers who have walked for an entire day, because today sees the monthly visit of the Mary Stopes team. Mary Stopes provides approximately 25% of family planning services in Uganda. Their outreach teams visit remote places, attracting clients from many kilometres around. People first sit through a lesson, learning about the methods and the benefits of avoiding teenage pregnancy, spacing births, and planning family size. The medics perform on-the-spot permanent sterilizations, as well as dispensing medium and long-term contraceptives. The most popular is the Depo-Provera injection, which lasts 3 months. This is what Prosy is asking for, as she complains her arm implant is giving her headaches. One of the nurses, Marie, says it's a huge task.
I think we need more support, because sometimes you find the number is overwhelming. We leave work at around 7, at around 8. You see there is a need for these mothers.
The high birth rate is also a consequence of major gender inequalities. Many men are unwilling to let their wives access family planning services, as they see it as an attack on their manhood. To bring them on board, the UN Population Fund promotes men's action groups, where they can discuss the issue freely.
Majority of the people around, most especially men, think that whenever they are put on family planning methods, their manhood can as well reduce, and they end up not producing anymore.
People are still having some misconceptions that family planning, if you use family planning methods, you produce children with very big heads. Family planning causes cancer. Family planning, if a person uses those contraceptive methods, produces a child with abnormalities. You see, we still have those challenges. For the life they live in, people have unmanageable families. People have a lot of problems, unplanned pregnancies, fistula, abortions. People are throwing the children in the pit latrines. Others are getting out of their schools. So we have to come out strongly to help our people.
Charles is one of the UN Population Fund champions. These are people picked as good examples and charged with spreading the news about birth control.
So he's taking us to the couple that has benefited from family planning activities. So this is the village. The village is called Chisekende.
It is a very big burden if you have many children. We want to have just 2 children so we can get food, get education, care for them, so they can look smart, have good things, and also enjoy life without these big, big burdens.
More and more women are willing to follow this example, but there is yet another challenge. Uganda has a very poor road network, often made of nothing more than mud tracks. On top of that, about 40% of health clinics are managed by faith-based organisations. Catholic hospitals refuse to stock contraceptives of any kind on their premises.
It's a combination of factors. One is availability of supplies. We have women who walk 10 kilometers to a health facility and they find there are no contraceptives. So that is a lost opportunity.
The National Medical Supply Network has been recently computerised and updated, but it is still a logistical challenge. Moses wonders why commercial goods can reach the most remote villages, but contraceptives can't.
The unmet need for contraceptives is 41% in Uganda. So why don't we work very hard to make sure that whoever wants to access contraceptives actually finds them? Because we are doing a lot of mass media, a lot of education for people to accept contraceptives. But if those few who have accepted change and they feel it's important for them go to the health facility and they cannot access the contraceptives, then we'll have gone back 6 steps backwards instead of forwards.
Family planning has only recently returned to the top of the agenda, with almost €4 billion being raised by the Gates Foundation, the UK government and several private and public investors in the effort to provide contraceptives to developing countries. How does the Ugandan government feel about being at the receiving end of such an international effort?
That one is really a bit tricky really to answer. Is it really colonizing, or should we say we also understand that it's not really being colonized? We also feel that actually we need to do something about it. It's not that we are being pushed to do it. We also really very much feel we want to do it because it is affecting our health. It's affecting our health system. It's putting a lot of pressure on what is the facilities available.
It's estimated there will be around 80 million unwanted pregnancies in poor countries worldwide this year, half of which will be aborted, and around 100,000 mothers will die in childbirth. Family planning is primarily about health and human rights, the right to choose when and how many children to have. The road is long, but it is hoped that by 2020, the latest funding will more than halve the number of women in developing countries who want and need modern contraceptives, but do not have access to them.
The more you have kids, the more you get confused. You don't get time to care about yourself, you don't get time to not care about your husband, the love is gone, the love for the kids is gone. So I hope, my dream is every woman in Uganda to be happy with the children she's having. Yeah, having children by choice, not by chance.